I think we need nurse innovators, nurse entrepreneurs, and nurse inventors now as much, if not more than ever, because the world we live in and the practice of oncology nursing is changing rapidly. And nurses are at the front lines of all of that. And nurses are also everywhere. I mean, not just in acute care settings and hospitals and infusion centers, but out in the community doing home nursing. They're in schools, they're in prisons, they're in all of these spaces where there are care needs and oncology care needs. And so they are seeing in real time all of the both challenges and opportunities that are unfolding. We heard this morning about the demographic shifts in who is receiving a diagnosis of cancer, both in the United States and in the world. Increasing numbers of aging cancer patients who bring their own complex life experiences and sometimes other conditions they're managing, and their strengths and resources that we are going to be caring for more and more in the community and at home as much as in the clinical center. We have all of this omic science and genetic tests and precision medicine coming into play and changing the face of what is therapy, and we're trying to also continue to build the science that supports all of the supportive care, the behavioral interventions, the environmental modifications that nurses know help to support health and healing. We have lots of things happening in the healthcare delivery space. We have mHealth and apps and consumer devices and wearables and sensors and all this data that are being generated. And I think translating all of that, making sense of it, figuring out what matters, what's meaningful, are we paying attention to the right things, and how do we explain it all to our patients, to families, to other members of the care team in a way that's going to improve outcomes in what we do. All of that landscape is there and ready for nurse innovators to play a role in setting the agenda and also in identifying what are the problems we should be solving, because sometimes the problems we have been given as these are the challenges we're addressing aren't necessarily the true problems that need to be solved. So nurses can participate in just about every level of innovation, from identifying the challenges to being the content experts on what things look like on the ground, what works, what doesn't, to helping to drive the design process, iterating designs that work, figuring out what actually then works or doesn't, and then who else should be at the table, and how do we get our patients' voices as part of that conversation, so that we're not just talking about them, we're talking with them and they are part of the team. I think nurse inventors, nurse innovators do face some structural barriers to having their ideas heard and fully supported and brought down that whole pipeline of innovation the way that some disciplines tend to. I see them having more support. So, even at my own university, in the College of Computer Science or in the business school, there are whole ecosystems to support innovation and people having ideas and then bringing them into reality. I think for nurses who are working at the bedside or in their day-to-day jobs, they already have so much they're being asked to do. And often they're being asked to do more with less, so that even if they have a great idea or even if they've made something work, they're not given a whole lot of space sometimes to take the time or to put the extra energy that might be required into making that thing something more than the immediate solution that it was. And they're also not necessarily invited to the table. I talked about in my talk how even hospital boards, which is nurses are the main workforce of hospitals, less than 5% of them have nurses at the highest level of leadership. And it's even worse in the biotech sector. And journalists don't necessarily talk to nurses as the experts of, to lead the public conversation about what should be happening. So as a result, nurses aren't resourced and supported to bring their ideas into reality. And sometimes too, because we all speak slightly different languages and have different sets of values, the value proposition that the nurse is bringing is not seen for what it can do for a health system. And so I think that's something that we are trying to change, and nurses are doing amazing work in that space, like Barbara Glickstein and Diana Mason, who recently replicated the study about nurse representation in the media, and nursing innovation efforts, sort of raising the platform and the profile of nursing in that space. But it's still sometimes a bit of an uphill battle. And nurses too, who've been at it for a while, haven't been encouraged historically to see themselves as having a right to be supported in really developing their ideas into inventions. And so I would love if nurses could feel like they could take ownership of that in a way that works for them, without also feeling like they have to take on extra burden in a world where they're already doing so much. And hopefully we will continue to find creative ways to make that possible. So there are a lot of resources to support innovation, and specifically innovation in nursing, which again, I think nurses are probably already doing this, whether or not they've recognized they were. But if you have an idea, I think one of the first steps, because it'll probably look a little different for every person, is finding a champion for that idea, and for you as a nurse innovator to be supported in developing that to the next stage. So in some cases, some clinical centers have these innovation centers now, or patient innovation centers, or resource and research centers, where people are encouraged to bring their ideas and perhaps connect with a whole team of people who can help figure out how to make that a thing in the world. But not everybody has that. So we also have organizations like ONS and the ONS communities, this online resource where you can crowdsource your ideas. You can send something out to the communities, and people can reply from wherever they are, because oftentimes there's someone out there who has tried to do something similar in the past. You can ask for mentors. We have some incredible nurse leaders who have really forged the path for the rest of us, and who are very generous with their advice. And we also have open source education platforms now that provide additional resources for nurses who want to innovate around design thinking, or where to find, whether that's funding support or a kind of center or resource to help develop your ideas. The Penn Nursing open source educational platform, which is all about design thinking in healthcare and innovation. It's a multidisciplinary resource, but it's being driven by nurses, including a very creative nurse, Marion Leary, who helped build that. And so I think we are gonna see more and more these things coming online, and innovation being part of even our educational structures for nursing. And if nothing else, if you're a nurse who's on social media, nurse Twitter, I had not been a user of it really almost at all until just this past year. But I find there too, it's like you have this whole hive mind of amazing people out there who will help you out when you put something out into the world and ask a question. You'll sometimes just get like deluged with responses of where to find a resource, or someone else who's doing this thing that you should connect with. And I love that, how we can connect with people now in ways that help us collectively change the landscape for nursing. I think my take-home message is that nurses have a long and proud legacy of innovating and inventing and making things work in ways that ultimately make the world a better place, not just in terms of medical outcomes, but really this larger notion of what health could look like in the world and what well-being could look like in the world while living and while dying. We have such enormous creativity. So I would like nurses to know not only that they can own that and they can claim that heritage and build on it and take these titles, not to just glorify themselves, because I can't think of almost any nurse who just is out there to, for themselves, but in the service of building a better system and of really highlighting places in our system that are broken and that nurse innovators can help to fix. So at the end of the day, whether they're taking on a new project or just continuing to show up for their patients and for their communities, they are enough. They're doing enough. You're doing enough. And hopefully the world will catch on.